Good morning, everyone. I hope you are feeling healthy and well today on this Monday morning. I am so excited to bring to you my next video. I am actually going to do a 3-part series about the preventative health visit, your wellness visit, that is recommended to be done each year with your primary care doctor. Now, this is important to do every year because there is a lot to cover, and sometimes you're not able to do everything that's recommended in that one year, especially if it's been a long time since you've gone to the doctor. There are a lot of things you may need to be caught up on. So it's good to check in about once a year to make sure that everything is evaluated and screened for and you're up to date so you can stay healthy and well. So how I'm going to separate this is the first video is going to be screenings and testing that is done for each patient who comes in for a wellness visit. And so that is going to take some time to go over. So that's going to be one dedicated video. And then the next video, we're going to talk about specific screenings that are recommended for female patients. And then the final video will be screening recommendations that are for male patients. If you are liking these videos, please tell me so by actually liking the video and subscribing. That would mean so much to me, and it would make sure that you stay up to date on when a new video comes out. You will keep getting your videos every Monday morning, and I look forward to not only this series, but I'm going to have many more discussions about general health topics and obesity related health topics. So like and subscribe so you can stay tuned and up to date, and you can take this information, directly apply it to yourself. You can share it with others. You can bring it back to your primary doctor and see if they agree that these recommendations are appropriate for you. Most insurances cover this visit absolutely free of charge. It is important to know that if you do talk about other things, then you may get a charge for those. So if you come for your wellness visit and you have an acute concern that you want addressed, or if you have chronic conditions or medications that are being managed, you may have a charge, and that is sometimes a surprise to people, but just something to note because that's that's combining 2 visits in one. And the insurance or the wellness visit that is included with your insurance is a focused wellness preventative health visit, and so something to be aware of. So what I do in my visits with my female patients is I have a general checklist, and so I go through this checklist to make sure that we do not miss anything that is important to this patient's health. So what first happens is that my wonderful medical assistant grabs the patient from the lobby and then gets their vitals, and that will include their weight, height, blood pressure, heart rate, temperature, oxygenation. They will go over all the current medications that the patient is taking and may touch on a couple of other things. And then I will come in the room and we will discuss if there is anything abnormal with the blood pressure. A goal blood pressure is a perfect blood pressure is 120/80, but typically for most patients, if your blood pressure is around 130/85, then your doctor is going to be pretty happy with that blood pressure. It's very common that patients' blood pressure is a little bit higher when they come to the office. They're a little bit nervous. We see this very often. It's so common that it has a name called white coat hypertension, and that's just a fancy term for when somebody gets nervous in the doctor's office and their blood pressure goes up, but on a day-to-day basis back at home their blood pressure is in a normal range. And so if your blood pressure is initially high, what will happen is later on in the visit, when you've kind of had some time to relax and settle in, then we'll check your blood pressure again and make sure that it is back down to that normal range. Again, perfect world, 120/80 or less, but really 130/85 is a pretty good blood pressure. Next on the list is colon cancer screening. This is colon cancer has rightfully so had a lot of press recently. We are seeing colon cancer at younger and younger ages, and because of that, the recommendation to start screening has decreased from age 50 to age 45. So now anyone age 45 through age 75 should make sure that they they are up to date on their colon cancer screenings. Again, if you have a significant family history of colon cancer, definitely talk to your doctor about that because you may qualify for screening at a younger age. But for the average age or the average risk person, we should start screening at age 45. And so if you do not have colon cancer in your family and you are not having any symptoms, no changes in bowel movements, no blood in your stool, you don't notice any like dark sticky stools, then you have your choice on how you want to be screened. And I typically offer two choices. First is a colonoscopy. The colonoscopy is our gold standard. It has a lot of benefits, and one of them is it gives us a lot more information. So with the colonoscopy, the GI doctor is able to actually take a look at the tissue in the colon, and if there is anything abnormal, they're able to take a biopsy and we can find out right away what is going on. They can remove a polyp if it is there, and that can help prevent the development of cancer in the future. If you have a totally normal colonoscopy, then you don't need another one for 10 years. And so it's usually not something that you need to do on a regular basis. If you do have polyps, then it depends on how many and which type, but usually the follow-up with guidelines would be a repeat colonoscopy in anywhere from 3 to 7 years, again, depending on the type or how many polyps that you have. The negatives of a colonoscopy are that you need to take time off work to get it done. You need someone to drive you to and from the procedure. There's potential complications with procedures, with any procedures, of course, and your GI doctor will go over those with you. But really the main reason that people do not want to get a colonoscopy or they kind of dread it is the prep that you have to do the night before. And so that is taking this fluid in that causes clearing of all the contents, all the poop in your bowel to come out, and so that the GI doctor can have a successful colonoscopy. And that's really important because if the prep is not done, then they're not able to see what they need to see, and you may need to repeat your colonoscopy later. The other option is Cologuard, which is a very convenient option for patients. It is a non-invasive way to screen for colon cancer. This is a kit that gets mailed to your home, and you get a stool sample, a little bit of your poop, and you put it back in that box. The instructions will be included on how to do this safely and sanitarily, and then you mail that box back to the lab. The lab will run their tests, and you'll get either a positive or a negative result. A negative result is great, and you can repeat the Cologuard in 3 years. If it's positive, that does not mean that you have colon cancer, but it means that you need to do a colonoscopy to find out why it was positive. An important cancer screening that is often underutilized and overlooked is lung cancer screening. Now, lung cancer is the third leading cause or third most common cancer in men and women, but it's the number one cancer-related cause of death in both men and women. And so it's really, really important that we do screen for lung cancer. Any adult in between the age of 50 and 80 who has smoked for 20 pack years and is either actively smoking or has quit within the last 15 years qualifies for lung cancer screening. So you may be asking, what's a pack year? How do I calculate that? What you do is you average how much you have been smoking most days. And so if it's 1 pack per day and you have smoked for 20 years, then you times 1 by 20, and that means you have 20 pack year history. If you smoked about a half a pack for 40 years, then you times 1/2 by 40, and you have a 20 pack year smoking history. So both of those people qualify for lung cancer screening. And I will link a calculator below so you can calculate your own pack year history to know if you qualify for lung cancer screening. And you may also be asking, what does that look like? So lung cancer screening is actually really easy to do. It's a quick CT scan of the chest. So it only takes a few minutes. It's non-invasive. It's done once a year. So you need to make sure that you're getting this done annually to be completely and to be fully screened for lung cancer. I'd also like to talk about vaccines that are recommended for adults. There are several to go over, so I will start with the flu vaccine, which is something that all adults should have updated every year. And it's really important to do this both for yourself, for your own health, but also for public health, for the safety of others. The more people who get the flu vaccine each year, the less prominent the flu is in the general community. And you're also helping to protect the people who may not be able to get the flu vaccine. So very young patients, babies, they are not able to get the vaccine until they are 6 months old. And some of our older patients or immunocompromised patients, you getting the vaccine, most people in the population getting the vaccine will make it less likely that they will get the flu. Of course, the flu vaccine is not perfect, so getting a flu vaccine will not guarantee that you will not get the flu that year, but it'll make it less likely. And it's important to note, so many people say that they got the flu vaccine and then immediately were sick and got the flu. That is not the case. The vaccine that we have is an inactivated vaccine, so it is not a live vaccine. You cannot get the flu from the vaccine. What you're really experiencing is your body's reaction to a vaccine. So it's your body's immune response. It's a good thing. It just tells us that you have a good immune system. That can look like some of the symptoms that can be associated with the flu, like a low-grade fever or chills or body aches, but they're short-lived. Again, it is not the flu, and it is not a reason not to get the vaccine the next year. COVID-19 vaccines have been around for a few years now, and it looks like each year we're going to be having a booster, so I do recommend getting the COVID-19 booster for almost all of my patients. Tetanus booster is another one that we all need. This one is a vaccine that you only need every 10 years, and because it's so spaced out, people often forget when they last had one. A little tip that me and my medical assistants like to remind patients is that if you're turning like 30 or 40 or 45, or the year is 2020 or 2025, those are really good times to get a tetanus booster, because then you'll know when you're due for one, especially if you're someone who moves often and your medical records are kind of scattered. Those would be good times to get the tetanus booster. Shingles vaccine is another really important vaccine to get. Kind of like colon cancer, we're seeing shingles at younger and younger ages, and so it used to be recommended anyone 60 or above be vaccinated. That age has now gone down to age 50. So anyone who is 50 or older qualifies for the shingles vaccine. Now, shingles is a reactivation of the chickenpox virus, but where chickenpox was all over the body, shingles happens in one area of the body. Worst case scenario, it can pop up on the face, and some people even it pops up as a vessel blister type rash that is usually pretty painful, sometimes itchy, even after the rash goes away. Some people have chronic pain afterwards, and that is what we're really trying to prevent with this vaccine. It's a very effective vaccine, over 90% effective at preventing shingles, but it is one that will turn on your immune system. So it's one that is known to have side effects afterwards. So it's really important to know that and to expect it and to plan for it. So I always tell my patients, if they're going to get the shingles vaccine, just to know that they may have these side effects. It doesn't happen to everybody, but again, more likely, and that they don't have anything important planned over the next couple of days after their vaccine. It's only 2 doses. You don't need any boosters after that, and they're spaced out 2 to 6 months apart. But again, a very important vaccine to get. And usually my patients who have known someone who has had shingles, they are more than happy to deal with the side effects of this vaccine because they know how painful and difficult shingles outbreak can be. Another important vaccine to think about is the pneumonia vaccine. Now, these guidelines have changed over the years, and currently it is recommended that anyone 65 and older have what is called the Prevnar 20 vaccine, the PCV 20 vaccine. As it's written right now, just having one booster of this at age 65 is enough. Now, you can can consider boosters every 5 years, and you can talk about this with your doctor and what might make sense for you. But one at age 65 may be enough, may be all that you need. We all get pneumonia vaccines as young kids, as babies, but this is a booster to make sure that you are covered for bacterial pneumonia, bacterial lung infections as you get older and more vulnerable. Now, some conditions may qualify you for a pneumonia vaccine at a younger age, as early as age 18. And some of these conditions include asthma or COPD or heart disease, liver disease, kidney disease, and diabetes. So if you have any of these or some other conditions, you may qualify for the pneumonia vaccine and talk with your doctor about this, but it would still be that one dose, the Prevnar 20. And there are some more specialized conditions that the recommendation is a little bit different. Again, if you have any chronic conditions, at your next wellness visit, talk to your doctor ask your doctor if you qualify for a pneumonia vaccine and which one. Another thing that I discuss with all my patients is diet, exercise, tobacco use, drug use, and alcohol. I am going to have specific videos for all of these things, but this is typically also included in wellness visits. And so you can see there's a lot to cover here, and that is why we want you to be seen at least once a year so we can continue to touch on these things over time and make sure that you are fully covered and up to date on your preventative health care, because prevention is worth a pound of cure, and it truly is. It's so much easier and so much more efficient and effective to prevent a disease than it is to treat a disease. And so please get set up with a primary care doctor or schedule your wellness visit with your primary care doctor to make sure that you stay happy, healthy, and well. I'll see you all next week, next Monday, and we will talk more. I look forward to it.